right now on Fox 5 News at 10.
Dr. Steve Salvatore, that headache you're suffering from may be coming from your nose. I'll show you a surgical procedure that promises to make your headache go away for good.
Always something.
All right, turns out headaches aren't always in your head.
Sometimes the nose, and Dr. Steve Salvatore explains.
Millions of Americans suffer with headaches. Well, some can be debilitating, but you may be surprised to know that the headache you're having may come from your nose. That headache you're suffering with can feel like a jackhammer in your brain.
Hello. Hi. How are you today?
All right. A little nervous.
Carol Wiggins suffered with devastating headaches for 7 years before she finally had enough.
They were so severe one time, they even felt like I might have been having an aneurysm.
When medications failed her, Carol went to Dr. Behin MD, a headache specialist from Christ Hospital in Jersey City. The CAT scan of her sinuses pinpointed the cause of her pain. It was coming from her nose.
Well, I was so surprised when he showed me on the diagram and how the blockage within the area can be, and with the bone laying on it. I was surprised.
Carol suffers from contact headaches. Her curved nasal septum is pushing against other structures inside her nose.
We see that the middle turbinate on the left side is pressing against the deviated septum and causing the headache.
With the help of a scope, Dr. Behin will work inside Carol's nose to remove the contact points, straighten the septum, and relieve her headaches.
If the pressure point and contact point is way up in the medial wall of ethmoid sinuses, then we have to go up there and release that.
Dr. Behin says the procedure works about 90% of the time, but not everyone with headache is a candidate for the surgery.
At the office, while they have a headache, I put some medication at the area of the contact point, and that releases some of the headache and the pressure. This is a very good indication that the procedure will work later on.
This is Carol just 3 weeks after the surgery. Today, she says she is headache-free.
I feel great. I don't have to take the medication like I was used taking before, and it's made me feel better. I'm breathing easier. I'm happy.
The recovery time for endoscopic nasal surgery is about 2 to 4 weeks. Like every surgery, there's always a risk of bleeding and infection. Endoscopic nasal surgery for contact headache costs between $7,000 and $10,000 and is covered by most insurance. Back to you.